Let's review 2 cases of hardware failure. This patient had a multiligamentous injury and underwent MCL and PCL repair, as well as ACL reconstruction with a Bone-Patellar Tendon-Bone autograft. What seems to be abnormal here? The yellow highlighted area is the bone plug, which has migrated and is not within the femoral tunnel. Remember, the 2 bone plugs from the inferior pole of the patella and the tibial tuberosity are initially fixed with interference screws but achieve stronger fixation through bone-to-bone healing. The bone plugs are secured within the tunnels by these screws, which press them against the tunnel walls until a bony union occurs. As seen on the CT scan, the bone plug that should be within the femoral tunnel has migrated intra-articularly, while the bone plug within the tibial tunnel remains well positioned. Even if the graft itself appears intact, if one end of the graft is not properly fixed, it is considered functionally failed. Bone plugs are particularly well visualized on CT scans, but on MRI, the bone plug and patellar tendon can be hard to distinguish on fat-suppressed images. However, on non-fat-suppressed images, like the T2 weighted images we see here, the fat marrow in the bone plug creates high signal intensity, while the low signal intensity of the patellar tendon helps to differentiate them. In this patient, the bone plug that should be within the femoral tunnel has migrated, as outlined in yellow on the image. Using an outside-in technique, the bone plug was repositioned into the femoral tunnel, and now, on follow-up imaging, a normal bone plug can be visualized within the femoral tunnel. Let's move on to another case. Take a look at the position of the interference screw tip. Today, we'll discuss a prominent intra-articular screw. We can observe an Achilles allograft and an interference screw. In these images, I've highlighted the Risberg ligament, PCL, and ACL allograft. Here, the screw has protruded into the joint cavity, causing irritation of the surrounding structures. On the oblique coronal image, the screw tip is marked with a yellow arrow, and the purple highlighted Risberg ligament is being mechanically impinged. This prominent intra-articular interference screw is irritating the PCL and, as a result, the Risberg ligament. Potential complications of such cases include a prominent intra-articular screw, intra-articular migration of the bioabsorbable tibial interference screw, or fracture of the screw, which can cause locking symptoms. Interference screws can migrate inside the joint, damaging the articular cartilage. In the coronal image, you can see that the prominent intra-articular interference screw has been repositioned to its original location. Thank you for watching this video. If you found it helpful, please hit the like button.
Visualize the need, unlock what you see. Master MRI, set your knowledge free. With Jee Eun Lee, it's time to rise. From grayscale scans to sharp trained eyes.